World Diabetes Day, observed on November 14th, is a global awareness campaign led by the International Diabetes Federation, IDF, and the World Health Organization, WHO. It highlights the growing impact of diabetes, promotes prevention, early diagnosis, and effective management, and emphasizes the importance of healthy lifestyles and access to care. Agenda 2030 and SDG 3. Agenda 2030, a global action plan adopted by all United Nations member states in 2015, focuses on 17 Sustainable Development Goals, SDGs, promotes an integrated approach that balances social, economic, and environmental sustainability. SDG 3, Good Health and Well-Being Goal, ensure healthy lives and promote well-being for all at all ages. Key targets of SDG 3, reduce global maternal mortality, end preventable deaths of newborns and children under 5, fight communicable diseases, HIV, AIDS, malaria, tuberculosis, reduce non-communicable diseases such as cancer, diabetes, heart disease, promote mental health and well-being, achieve universal health coverage, access to affordable medicines, vaccines and health services. Strengthen capacity for emergency preparedness, pandemics, disasters. Why it matters. Health is central to sustainable development. Without good health, progress in education, economic growth, and poverty reduction is limited. Global challenges like COVID-19 highlight the urgency of strong health systems. What is diabetes? Diabetes is a chronic medical condition that occurs when the body cannot properly regulate blood sugar, glucose levels. Glucose is the main source of energy for the body's cells, and insulin, a hormone made by the pancreas, helps move glucose from the blood into the cells. Types of diabetes. Type 1 diabetes, an autoimmune condition where the body does not produce insulin. Type 2 diabetes, the body either doesn't use insulin effectively or doesn't produce enough of it. Impact on health can lead to complications if not managed: heart disease, kidney issues, nerve damage, vision problems. Requires long-term management through lifestyle changes, medication, and sometimes insulin therapy. Importance of awareness. Rising global concern, diabetes cases are steadily increasing worldwide, making it one of the most pressing public health challenges of our time. Preventable complications. With proper awareness, lifestyle changes, and timely medical care, many of the severe complications of diabetes can be prevented. Affects all ages. This condition does not discriminate. Both children and adults are at risk, highlighting the need for early education and lifelong management strategies. Type 1 diabetes, autoimmune condition. The body's immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Onset often begins in childhood or adolescence, though it can develop at any age. Treatment requires lifelong insulin therapy, injections or pump. Careful monitoring of blood sugar is essential. Importance of education. Understanding the condition helps patients and families manage it effectively. Education about insulin use, diet, and recognizing warning signs like hypoglycemia can save lives. Type 2 diabetes, insulin resistance. The body does not use insulin effectively, leading to high blood sugar levels. Lifestyle related, strongly linked to diet, excess weight, and physical inactivity. Most common type, accounts for about 90% of all diabetes cases worldwide. Gestational diabetes, GDM, definition, a type of diabetes that develops only during pregnancy. Duration, usually temporary, but requires careful monitoring. Risks for mother and baby. For baby, higher birth weight, macrosomia, risk of birth complications, premature birth, low blood sugar after delivery, long-term increased risk of obesity and diabetes. For mother, complications during delivery, e.g. need for C-section, preeclampsia, high blood pressure during pregnancy, higher chance of complications if unmanaged. Future health risk. Mothers with GDM have an increased risk of developing type 2 diabetes later in life. Babies born to mothers with GDM are also at higher risk of type 2 diabetes as adults. Prevalence. Gestational diabetes accounts for 90% of all diabetes cases during pregnancy. Risk factors for type 2 diabetes. Genetics, family history increases the likelihood of developing type 2 diabetes. Lifestyle, poor diet, physical inactivity, and excess calorie intake contribute significantly to risk. Other health issues. High blood pressure, obesity, and related metabolic conditions increase susceptibility. Having these conditions raises the chance of developing type 2 diabetes later in life. Prevalence. Type 2 diabetes accounts for about 90% of all diabetes cases. Symptoms of diabetes. 1. Frequent urination, polyuria. The body tries to remove excess sugar through urine, often leads to dehydration. 2. Increased thirst, polydipsia, and hunger, polyphagia. Cells are not getting enough glucose for energy. This triggers increased appetite and thirst. 3. Fatigue and blurred vision. High blood sugar can make you feel constantly tired. Sugar buildup in the eyes can cause temporary blurred vision. Early warning signs are often ignored. Complications if diabetes or high blood sugar goes untreated. 1. Heart disease and stroke significantly increases the risk of heart attacks and strokes. Major long-term consequences that can be life-threatening. 2. Kidney and nerve damage. High blood sugar can damage kidneys, diabetic nephropathy, potentially leading to dialysis. Nerve damage, neuropathy, may result in pain, numbness, or infections that could require amputations. 3. Vision problems. Diabetic retinopathy can damage the eyes and lead to blindness. Early symptoms are often subtle and ignored, making regular eye checkups crucial. Diagnosis of diabetes or prediabetes. 1. Blood sugar test. Fasting glucose levels are measured after not eating for 8 hours. Helps identify elevated blood sugar levels that may indicate diabetes or prediabetes. 2. A1C test. Measures average blood sugar over the past 2 to 3 months. Useful for monitoring long-term glucose control and identifying risk of complications. 3. Importance of early detection. Catching high blood sugar early can reduce the risk of complications such as nerve damage, kidney disease, and vision problems. Enables timely lifestyle or medication interventions. Management of diabetes. Medication. Insulin therapy necessary for type 1 diabetes and sometimes for advanced type 2 diabetes. Types include rapid-acting, short-acting, intermediate-acting, and long-acting insulin. Oral medications, common for type 2 diabetes. Examples include metformin, reduces glucose production in the liver. Sulfonylureas increase insulin release from the pancreas. SGLT2 inhibitors help remove glucose via urine. Always take medications as prescribed and follow up with your healthcare provider for dose adjustments. 2. Diet control. Balanced meals include a mix of carbohydrates, proteins, and healthy fats. Portion control helps prevent spikes in blood sugar. Limit sugars and refined carbs, reduces rapid increases in glucose. High fiber foods. Vegetables, whole grains, and legumes improve glucose control. Consider meal planning with a dietitian for individualized guidance. Regular monitoring. Blood sugar checks, daily self-monitoring using a glucometer. Frequency depends on diabetes type and treatment. HbA1c tests every 3 to 6 months to track long-term glucose control. Watch for symptoms. Fatigue, excessive thirst, frequent urination, or blurred vision can indicate blood sugar fluctuations. Tips: physical activity. Regular exercise helps insulin work more efficiently. Weight management. Maintaining a healthy weight improves blood sugar control. Avoid smoking and limit alcohol. Both can complicate diabetes. Regular medical checkups. Eye exams, kidney function tests, and foot care are essential. Prevention strategies awareness campaigns. Educating communities about the risks and symptoms of diabetes is vital. Awareness campaigns help people understand lifestyle factors such as diet and physical activity that can prevent the onset of the disease. Screening programs. Early detection through regular screening programs allows for timely intervention. Identifying prediabetes or other risk factors early increases the effectiveness of prevention efforts. Role of Lazarus Union Academy 1. Health education. Provides students and families with essential knowledge about health and wellness. Promotes understanding of healthy lifestyles, disease prevention, and overall well-being. 2. Community outreach. Extends awareness and health education beyond the academy. Engages the broader community through workshops, campaigns, and public programs. 3. Empowerment. Encourages individuals to make proactive health decisions. Supports personal and community growth through informed choices and self-care initiatives. Conclusion. Diabetes is manageable. With proper care and awareness, prevention is possible. Healthy choices reduce the risk. Together we can act, building a healthier future.
Lazarus Union, serving humanity, united in peace, in solidarity, with honor, with courage. Together we stand, building a future.